Good afternoon, Hilton Highfield. Let's begin the warm-up session. What is the dignity of being a nurse?
Being a nurse is a noble and rewarding profession that involves caring for people's health and well-being. One of the dignities of being a nurse is respecting human dignity. Nurses respect the inherent dignity, worth, and uniqueness of every person they encounter, regardless of their health condition, culture, religion, or background. Nurses treat their patients with kindness, compassion, and empathy, and uphold their rights to privacy, autonomy, and quality care. Having a sense of purpose. Nurses have a meaningful and fulfilling career that makes a positive difference in people's lives. These are some of the dignities of being a nurse that make it a rewarding profession.
What are the skills I need to be a nurse?
To be a nurse, you need a combination of both hard skills and soft skills. Hard skills are those that are learned through training, education, or certification. Soft skills are habits or traits that enable you to work well with others. Hard skills can be acquired through formal education, such as a diploma, associate degree, or bachelor's degree in nursing, and certification or licensure exams. Soft skills include interpersonal and communication skills that are vital for building rapport and trust with patients and colleagues, and can be developed through experience, feedback, reflection, and self-improvement. However, depending on the specialty, setting, and role, one may need additional or specific skills to excel in the nursing career.
How would you deliver bad news to a patient or their family members?
It is a tough but inevitable part of the job, and I believe I have learned to navigate it effectively. I understand how hard it is to watch a loved one feel uncomfortable, so I always try to demonstrate empathy when speaking to patients' family members. I calmly explain the patient's condition and the next steps we need to take, giving them time to process that information and ask as many questions as they need. Even though the news must be upsetting, I knew I needed to be honest about the situation to manage their expectations appropriately. I would never want to give families false hope about the outcome. However, I also emphasized our medical team's commitment to providing him with the best care and treatment options available.
Describe your ability to handle high-pressure situations.
I've always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Discuss the personal attributes that make you especially qualified as a nurse.
I am extremely detail-oriented. Whether I'm charting and keeping records, noting patient conditions, or administering medication, I always double-check my work. Efficiency is important, but not at the expense of accuracy, and I believe in removing as many barriers to accurate care as I possibly can. I'm also very observant. I tend to notice the details about patients' conditions that others miss. Whether it's a glassy look in their eye or a certain way they are clutching their abdomen, I look for and record details that may offer clues into the causes behind a patient's condition.
Your preparation time is over. Please start your OET speaking roleplay.
Hello, Mihiraa. Good morning. How are you feeling today about everything?
Oh, Hilton, thank you. I'm just a bit overwhelmed, to be honest. The doctor told me I have high blood pressure, and it came as quite a shock. I feel fine, no symptoms or anything, which makes it even more confusing. I don't really know what it all means for me.
I completely understand that this news can be unsettling, especially when you're not experiencing any symptoms. It's perfectly normal to feel confused or even a bit anxious. My main purpose today is to discuss this new diagnosis of high blood pressure, or hypertension as it's medically known, and to answer any questions you might have about managing it. We'll go through what it means, what steps you can take, and what to expect going forward.
All right.
To begin, could you tell me a little bit about what you currently understand about high blood pressure?
Well, I know it's not good, and my father had it, and he ended up having a heart attack when he was older. That's why I'm so scared. I thought it meant I'd have to take pills for the rest of my life, or that something bad is going to happen soon. I also heard it's caused by stress, and I've been a bit stressed lately with work, so I thought maybe that's it.
Thank you for sharing that, Mihiraa. It's really helpful to know your concerns, and it's understandable why you'd be worried given your father's history. Let me explain a bit more about what high blood pressure actually is. High blood pressure, also known as hypertension, is a medical condition where the force of the blood pushing against the walls of your arteries is consistently too high. Your arteries are responsible for carrying blood from your heart to the rest of your body, and when the pressure inside them is elevated over time, it can put extra strain on your heart and blood vessels. This increased pressure doesn't always produce noticeable symptoms, which is why it's often referred to as a silent condition. Many people can live with high blood pressure for years without feeling unwell, which can make it hard to detect without regular monitoring. It's completely understandable to feel concerned after hearing you have high blood pressure, but please know that you're not alone. This is a very common condition, and the good news is that it's highly manageable. Many people are able to bring their blood pressure into a healthier range through relatively simple lifestyle adjustments, such as eating a balanced diet, being more active, reducing stress, and limiting salt or alcohol intake. In some cases, medication may also be recommended, which can be very effective and well tolerated. It's important to remember that a diagnosis of high blood pressure is not an immediate crisis. What matters most is consistent management and regular checkups. By working closely with your healthcare provider and making small but meaningful changes, you can significantly reduce your risk of complications and continue to live a full, healthy life.
Thank you, nurse, for breaking it down so clearly and thoroughly. But how to manage it? I'm willing to try anything, Hilton, but I'm not sure where to start. I love my food, and I'm not really one for the gym.
I appreciate your willingness, Mihiraa. We can definitely find things that fit into your routine. Making certain changes to your diet and lifestyle can have a powerful and positive impact on your blood pressure, and more importantly, on your overall health and well-being. One of the most effective steps you can take is to adopt a balanced diet that is low in salt, saturated fats, and added sugars. Reducing your salt intake, in particular, can help lower the volume of fluid your body retains, which in turn eases the pressure on your arteries. Choosing fresh fruits, vegetables, whole grains, lean proteins, and healthy fats like those found in olive oil or nuts can nourish your body while supporting heart health. Limiting alcohol intake is also key, as alcohol can raise blood pressure and interfere with the effectiveness of medications. Even modest reductions in consumption can make a noticeable difference over time. In addition to dietary changes, incorporating regular physical activity into your daily routine can be extremely beneficial. You don't need to engage in intense workouts. Even moderate activities such as brisk walking, cycling, or swimming for about 30 minutes a day can strengthen your heart, help regulate your weight, and lower your blood pressure naturally. Exercise also improves the elasticity of your blood vessels, allowing blood to flow more easily and reducing the strain on your cardiovascular system. Maintaining a healthy weight plays a major role as well. Carrying excess weight, especially around the abdomen, increases the workload on your heart and can make it more difficult for your body to regulate blood pressure. Even losing a small amount of weight can lead to meaningful improvements. Finally, it's important not to overlook the effects of stress. Chronic stress can cause temporary spikes in blood pressure and, over time, contribute to long-term problems. Techniques such as deep breathing, meditation, gentle stretching, and even simply taking quiet time for yourself can help you manage stress in a healthy way. All of these adjustments, while they may seem small on their own, can work together to reduce the strain on your heart, improve the flexibility of your blood vessels, and support your long-term health. The journey toward better blood pressure doesn't have to be overwhelming. With support and steady steps, it's entirely achievable.
Yes, these are doable.
Moving forward, it will be very important to monitor your blood pressure regularly. Mihiraa, this can involve checking it at home with a personal blood pressure monitor and also ensuring you attend your regular GP appointments. This helps us track your progress and make any necessary adjustments to your treatment plan. It's crucial to emphasize adherence to your treatment plan, meaning consistency with any medication if your doctor prescribes it, and a long-term commitment to these lifestyle changes we've discussed. The ultimate goal here, Mihiraa, is to prevent future complications like a heart attack, stroke, or kidney disease, and to help you maintain your health and well-being for many years to come. Do you have any questions about this part?
Okay, got it. I don't have any questions as of now. I understand the importance.
That's perfect. Feel free to talk to us, Mihiraa.